Good morning. This is Karen Spar, Executive Vice President of the Southport Oak Island Area Chamber of Commerce, and we are here with Faces of Commerce at Dosher Medical. Hi, everybody.
Good morning.
Good morning. We are here with Dr. Gauthier.
Gauthier.
I did it wrong. I'm always doing it wrong. That's why you always go by Dr. G, correct? Dr. G, thank you so much for being on Faces of Commerce this morning. Tell us a little bit about yourself. Where did you come from?
I was born and raised in Massachusetts. Went to medical school in Wisconsin, where I practiced for 17 years. Active duty Navy for 3 years as a physician. I ran the urgent care center at Norfolk Naval.
Go Navy.
You go Navy, beat Army. And then about 7 years ago, I moved to North Carolina, where I was the women's health director at the VA in Salisbury, and now here.
That's wonderful. Welcome. I know you're accepting new patients here.
I am. Mm-hmm.
Where is the clinic?
Right now at Oak Island, and I'm also helping Dr. Heilman as he moves into a new position, and I'll be doing a lot of the gynecologic care there at the Women's Center next to the hospital.
Okay, wonderful. Mm-hmm. So you'll be doing double duty.
I'll be doing double duty, yes. Tomorrow, seeing patients there and then coming here. Yeah.
That's great. So Dosher Medical Clinic here over on Oak Island is located across from Town Hall.
Yes.
And where do they go to find out more information? Is it
Dosher.org.
Dosher.org.
Mm-hmm.
That's great.
Yeah.
And so we were talking earlier about the coronavirus.
Mm-hmm.
And tell us a little bit about how we're prepared here in North Carolina.
So I went on to the state website today to look for that, since the president gave an intro in what the country's doing. We now have testing at the state lab, so if people think that they've had exposure, they have a fever, shortness of breath, or a cough, and they may have been exposed, we can refer them over to the health department who'll do the testing up to the state lab. But the big thing is staying home.
Stay home.
Staying home, self-quarantining. There's no treatment for this disease yet. The people that are primarily going to be affected, the very young, the very old, and those with chronic illnesses. But if you do the safe thing, wash your hands, stay away from people, drink lots of fluids, hopefully everybody will be fine.
That sounds great. It's kind of like the flu.
It's very much like the flu. So there's going to be some confusion during flu season. Is it coronavirus or flu? And the big thing, do you have exposure? Did you meet with somebody who you knew had the virus? Were you traveling? So those are the things we'll be asking.
That sounds great.
Mm-hmm.
And so your medical experience in the Navy, I'm sure, has translated to the local community very well, because
it's a mariner community. Yeah.
So we're awfully glad to have you here. And Eileen, I know you're the marketing director here at Dosher Memorial Hospital.
Yes, Karen.
And you've got some stuff that you'd like to make sure everybody knows and is aware of.
Yes. The first is a service line enhancement. We are now accepting self-request mammography. And this is new, this is brand new. And there are certain requirements, or I should say restrictions. So there's a special line you can call at Dosher to talk to a receptionist or scheduler who can go over some of those criteria with you, and that phone number is 910-454-4702. What self-request means, I should actually back up a minute and start with what it means. It means that you don't necessarily have to have a doctor's order to schedule your mammogram. So if you meet the criteria, and the most important criteria, actually there's several criteria, but I think one of the most important is you need to be asymptomatic, meaning if there is a problem, this is not for you. You need to have a provider that you're working with to schedule a mammogram. And Lorraine, before you use the words, I want to make sure I say it correctly. If you don't have a doctor's order, if you don't have a provider who can get the report, you will get the report.
I will get that and then communicate with the patient what the result is. This is a great system. I had it where I was in Salisbury. One of the hurdles to women getting mammograms is, gosh, I have to go to the doctor. I just need my mammogram. Mm-hmm. So if we can get women to get it done, it's a lifesaver. So I'm a big fan of this program.
Good.
So it's very important to get your mammogram every year?
There are different guidelines for different women that have been placed by the United States Preventative Task Force, but my opinion is yes, every year after 40.
Sounds good. I guess I'm after 40.
And that is also one of the other criteria, is that you must be 40 years of age for self-request. Because, again, correct me if I'm wrong, insurance might not cover it.
Correct.
If you're under the age of 40.
Correct, unless there's a reason you're high risk. So, but those are not self-referral patients. They have to see a doctor for them.
Exactly.
But it's very important, so don't let the insurance piece hold you back from your mammogram, correct?
Yeah.
And apparently there's a health department in Boiling Springs that does mammograms as well for a lesser price. But the mammograms, I found out yesterday working with Dr. Heilman, are actually really affordable here, which is really nice to hear.
We also have patient assistance available for patients that may not be able to afford to have one. We can help them with that. So.
That sounds great. And this is Kate.
I'm Kate Inman. I'm the network administrator for our clinics. And if you'd like to schedule a new patient appointment with Dr. G, the phone number to call is 278-6414, and they can help you get that new patient appointment scheduled. And Dr. G has joined our other clinics, as far as we have 7 clinics, and then we have Bald Head during the summer. So we have multiple clinics located throughout Southport and Oak Island, and have providers there all accepting new patients and want to be able to meet your needs.
That sounds great. And all those clinics are right here in our community, so they are really convenient for everyone to partake in a good healthcare maintenance system.
You guys have the urgent care?
Yes, we have urgent care on Long Beach Road. So especially right now, they have been seeing a lot of flu and taking care of a lot of patients that may not have a provider, or their provider is, scheduled out and they can't get in. They are happy to see patients on a walk-in basis and take care of whatever your healthcare need may be.
And Dr. G had mentioned going over into the Dr. Heilman's practice. And I know Dr. Heilman has a new position now with Dosher. Eileen, do you want to address that?
As of Monday, Dr. Heilman will have a new position along with Linda Stanley. Our CEO, Tom Steamers, has resigned, and his last day at Dosher Memorial Hospital is tomorrow, which is Friday, February 28th. First, I just want to acknowledge Tom's presence and his leadership with the hospital for the past 7 years, and the list of accomplishments that he has accomplished in the past 7 years has been admirable. I know that if Tom were here, he would give the entire Dosher staff a lot of credit for what he was able to accomplish. So it's a good moment for me to say, when you have a 300-person organization, it takes 300 people to run that organization. So with Tom's leadership together, the hospital was able to accomplish a lot in those 7 years. With Tom stepping down, we are bringing in, or the Board of Trustees, I should say, has chosen 2 interim leaders, Dr. Brent Heilman from Dosher Medical-Oak Island, who is also the Chief Medical Officer of Dosher Hospital. He's also the Director of the Wound Care Center, so this will just be another hat for Dr. Heilman to wear. And Linda Stanley, who is the president of the Dosher Foundation and has been for several years. And just to throw out a number which had a lot of impact on me when I read this in the paper yesterday in the State Port Pilot, which has been doing beautiful coverage on the transition. Together, Linda and Dr. Heilman have a combined 59 years of history with Dosher Hospital. So we are in very good hands with very experienced leaders and people who are very much invested in the present and the future of the hospital. So it's bittersweet. It's sad to say goodbye to Tom, but I am very optimistic about the leaders that we have in place next week.
That sounds great. Thank you, and we appreciate all Tom did. And he's a maniac when it comes to dessert. I don't know if y'all know that, but he loves to serve some cake. Now, if you have a cake, he'll cut it up and he'll serve it, and he loves it.
Has he ever served you ice cream?
Ice cream.
No.
Oh, you don't even know. Yeah.
Oh my gosh. All right. So Dr. Brad and Linda, y'all need to work up on your dessert serving capability. Get some tips from Tom. Dr. G, thank you so much for coming to our community and being a new physician here and taking a chance on the Southport Oak Island area.
Oh, I love it here.
and we hope you're around for many, many years.
I will be.
And she is accepting new patients, so call Kate.
Yes, you can call 910-278-6414. That's the Dosher Medical-Oak Island office, and they can get you set up with Dr. G. And you can also contact the Women's Health Clinic if you are interested in seeing her for your annual women's needs.
That sounds great. And Eileen, the self-breast exams, where do they go to find out more about that?
Dosher.org/mammogram or 910-454-4702.
Thank you very much, ladies, and I hope you all have a very good day, and wash those hands and keep the flu away.
Wash those hands.
Thank you.
Thank you.